Welcome to the Evolved Caveman, where men learn to be successful and happy with your host, Dr. Jon Schinnerer, as he shares the most impactful ideas and practices for you to get the most from your relationships, your work, and from your life. Now here's Dr. Jon.
Hey everybody, this is Dr. Jon back with the latest round of the Evolved Caveman. And today I am really honored to have with me Jon Mitchell. And Jon is a functional medicine physician assistant turned health consultant. Jon works virtually with highly driven individuals to resolve their chronic health issues and optimize energy and mental clarity. Jon, thanks again for coming on. By the way, to everyone, this is the second one that we've recorded. Jon's been very generous with his time because I screwed up the initial recording. So thank you again.
It's all good. And it's actually going to be better this time. So I'm excited.
So tell me a little bit, you started off in conventional medicine and then moved over to functional medicine. Tell me about how your career has progressed. Why that direction?
Yeah, so I've had a lot of experience in the conventional realm for the better part of a decade. I did pharmaceutical research. I was an EMT and ER tech. I did toxicology research. And then while I was through my whole medical education, about halfway through, I realized this isn't really the right field for me. What I love and what I'm passionate about is, I love freedom and independence and self-sufficiency. And what I want is to help my clients do the same thing. I wanted to help people get healthy and live the lives they want. And what I realized was I wasn't being taught that in medical school. What I was being taught was the name it, blame it, tame it game. You put a name to symptoms in the form of a diagnosis, you blame it for how people feel, and then you tame it typically with a prescription. So we're treating symptoms, but we're not actually helping people resolve their chronic health issues. So that's where halfway through, I was like, I don't know, maybe I'm going to leave this completely and just do something totally different. And it was at that point, or it was soon after I graduated, that I discovered functional medicine. And what that is it's a way of practicing medicine where you're addressing the root cause of disease as opposed to treating symptoms with medications. And that started to really resonate with me. So I started doing all that training, going to the Institute of Functional Medicine, doing a bunch of internships. But even then, I noticed that a lot of practitioners were still kind of doing the same thing as conventional medicine, just with a different toolbox. They were, instead of prescribing prescriptions, they were using supplements. So again, it pushed me to find mentors who were doing things differently. So the question I asked was, who's getting the best results clinically for their patients across the board? And that really helped me find people who were doing things at the highest level, because in the end, that's really what we all do as professionals. The goal is to get people the outcomes they want. And it was through that I've discovered some amazing mentors that have helped me evolve my practice. And now like you said, I work as a virtual health consultant, helping people just resolve their chronic health issues and then just feel amazing.
And so lay it out how you would work with a typical client if a client were to come see you.
Yeah. So, and this is definitely kind of evolving as I'm realizing, as we talk about with men, some men don't want a full program. Traditionally, I work with people over a 6-month period because change takes time. But I realize some men don't want those long, they don't want the hand holding. They're like, just give me the information, tell me what to do, and I'll do the work. So, essentially, the goal, though, is I help people identify the issues that are leading to the development of disease as opposed to just treating symptoms. So we go, okay, let's look at your environment, your lifestyle, nutritional and biochemical imbalances that are creating how you feel, and let's address those. So that's essentially the format that it works at.
Okay, and then other functional medicine practitioners that I've spoken with, I think after that would be my guess, is they'll do a blood panel and then look at where things are and kind of try and titrate those levels with supplements.
Yeah. So you always want to quantify. So when it comes to specifically dietary recommendations and supplements, you always want to quantify before you start using things to see what do people actually need. I think it's always best to start with, when you have deficiencies, to start with food. Your body just assimilates it better. It's more well known. And I found you get better results when you do it through food. And then if you really have significant deficiencies, that's when you use supplements. And that's really what the term supplement means. It's supplemental to, a whole, like a healthy diet. And, definitely in our day and age, people are deficient in certain things. So if you are significantly deficient, we will use supplements, but it should really be just kind of short term to get you back to being in balance. That's the goal.
All right. You mentioned men earlier, and I think last time we touched on sort of what are some of the emotions or situations that keep men from seeking out healthcare, whether it's functional medicine or traditional medicine or anything. What are some of the things that you see?
Yeah. So here's a funny or interesting statistic. 40% of men don't go to the doctor until there is something seriously wrong. So that's pretty big. And a lot of the men that I see, a lot of times it's because their wives are telling them, like, you need to go see someone. This guy looks pretty good. So there's a few things I think going on. One, there's definitely a little bit of ego is men kind of want to go, I think I can figure this out on my own. They got Dr. Google that they can go to. There are all these blogs and podcasts, and they're like, I'm just going to figure this out on my own. And, in some cases you can, but a lot of times I think we get ourselves into trouble. Two, we don't want to be seen as vulnerable and saying that we actually have an issue, which is understandable. And then three, I think just going to a doctor is uncomfortable. I think it's, you don't want to get bad news. And you don't want, I don't know anyone who really wants a stranger to be fondling their balls and possibly sticking their finger in their butt. And it's just not a really positive experience. You have to sit in a smelly waiting room. There's a stark white room that you're waiting 15, 20 minutes for the doctor to come in. It's just not the ideal experience. So I think all of those things come together. It creates an environment where men are just like, you know what, I'd rather not go. But the issue is, and a good example is I was on the phone with a potential client who had stage 4 prostate cancer, and he had prostate issues for years prior and just never got it checked out. He was having trouble urinating. But he had to go all the time, and people would tell him, you need to get this checked out. And by the time he got it checked out, it was way, way further down than it had to be. And this is the thing is, you just want to make sure that you're staying on top of things. Like, I know it can be uncomfortable, but you do want to make sure that you're taking care of yourself. And a sobering thought and a way to frame this is, we spend about $10,000 a year on owning, operating, and maintaining a car. Yet how many people actually spend even a fraction of that on their health?
Yeah, it makes me think while you were talking, I think you're absolutely on point. The other thing that comes to mind is the way that we're socialized as men, and we're socialized to be an expert about things or to know everything, to be self-reliant. And then we're being asked to go into the situation where we're not the expert on what's going on. We don't even know what's going on with our body. And we have to admit that we don't know everything. And we can't be self-reliant, which kind of flies in the face of how we're socialized from a very young age. It also makes me think of, I've got an old friend, his dad, he's now passed, but he had a real fear of going into the dentist, which was funny because my dad was the dentist. I'm like, dude, you're my best friend. Like, just tell your dad to go see my dad. But he would go in the garage and pull out his own rotting teeth with pliers. I mean, that's kind of the sick epitome of self-reliance. Yes. But I think it was also kind of giving into his own fear that he felt that was better than going in and, I don't know, getting a shot and getting it drilled or whatever he thought was going to happen.
Yeah. And one thing I always like to think about is, if you actually look at most of the top performing people in most fields, they get a lot of help. All of the top athletes have numerous coaches that they work with all the time. So like, if LeBron James needs that many coaches, like, I think it's okay that you can get some help from people. Absolutely.
Yeah. Yeah. And so one of the other things we talked about was the specific protocol that you use, the balance protocol.
Yes. So sure. So the balance protocol is a framework that I use. I learned it from one of my mentors, Dr. Beck, and it's been used over 20 years. It's worked on over thousands of people to help them resolve all sorts of chronic health issues, things like, gut and hormonal issues, autoimmune conditions, brain fog, fatigue, weight loss. I mean, you name it. But what separates this from how other people operate is we meet people where they're at. We treat people as an individual instead of doing cookie cutter protocols. So we're quantifying what makes them unique using the right labs. And then we're going to correct the things that are leading to the development of disease, like your environment, your lifestyle, your nutrition. And again, it's all purposely tailored towards your own biochemistry, your history, your lifestyle, your goals, mindset, all those types of things. So what I always say is I don't treat diseases, I balance systems. And when we balance the systems biology, that's when you get kind of like disease cessation for free.
So what are some of the diseases that you've treated in the past?
Yeah, so it ranges. It can be things like thyroid disorders to, just general fatigue, brain fog. Recently, I'm working with a client who had he has a basal cell carcinoma, like a localized cancer on his head, and that's it was like 2 or 3 inches in diameter when it came to me, and he wanted to get it removed. And I was like, that's totally fine. But in the course of us working together, it's almost gone at this point without even having to get it surgically removed. I mean, we're going to make sure that we're monitoring it with his dermatologist, but it's really just a wide gambit of things that that I work with. It's just a matter of making sure people put in the work, because it does take some time and a driven person to do it.
You also mentioned mindset as part of that balance protocol. Like, how does mindset come into this?
It's huge, because I think what people don't realize is especially emotional trauma can really keep you from healing. I've actually just had a friend recently whose wife was diagnosed with breast cancer in her 30s. And I asked him, I was like, do you guys have any like trauma recently? And he was just saying like her and her mom were having these significant family issues. And one thing I've learned through working with people is that trauma can beget a lot of diseases, cancers especially. So you want to make sure that we're looking at that, and if there are any issues, addressing them.
Yeah, and it's interesting because I work in that area of trauma and emotion quite a bit. And I've had clients come in the past where they've had significant, 2 or 3 traumatic events in the past 1 to 2 years. And it's funny how a lot of people, I don't know about a lot, some people think, how could my emotions be causing me physical problems?
Yes. And here's the thing though, when you actually understand the biochemistry and the biology of it, you can actually track these things. Like when you're stressed out, your cortisol rises. When your cortisol is elevated too much, it suppresses your immune system. If your immune system's suppressed for too long, that's when you can get the development of things like cancer. So there are biological mechanisms of how this works. And the beautiful thing about science now is we're actually able to elucidate those things.
Yeah. And I think, one of the theories about depression is that inflammation is causing it, that it's actually inflammation in the brain. And, we know that when you're depressed, it also increases inflammation in the body. So it's bidirectional. And I think a lot of these systems are bidirectional. They go both ways.
Absolutely. Yep. We are in 100% agreement.
Yeah. I mean, so, I know when I've gotten depressed in the past, like my old injuries will come up and I'll be like, oh man, my back hurts more. And, oh yeah, okay, I'm in a depressed mood right now. That makes sense.
And this is why again, everything is so sobering with the balance protocol, is because we go, okay, you're feeling depressed or you have this condition. What are all the areas that can be contributing to this? So like you said, is there inflammation within your body coming from an infection? Is it coming from your gut? Is it coming from something in your environment? Like, are you getting exposed to heavy metals, or there's a whole host of things, and that's why you have to address all of them, because the body is so interconnected. A lot of people want to just think there's one thing causing their disease. Like, I have this because I'm deficient in this. And a lot of times it's a number of things contributing to a disease state.
One of the things I came across as one of these possible indicators, this was just yesterday, I was talking with an MD about testosterone replacement therapy. Mm-hmm. And, within that, I think he was looking at the thyroid, he was looking at vitamin D, vitamin K, vitamin A, I believe. There might've been something else in there. But, one of the things that this can affect, if you get your hormone levels right, is less depression, less anxiety.
Yes, if you have low testosterone, a lot of the big symptoms, one of the big ones is brain fog, fatigue. You can't get an erection in the morning a lot of times, weight gain. Again, but the question is, if you are low in T, why do you have it? So that's where you have to start looking at the terrain. Like, we need adequate amounts of cholesterol actually to produce enough testosterone in our steroid hormones. You need to make sure the enzymes and nutrients that are necessary for their production are there. Things like copper, zinc, magnesium, and manganese, your B vitamins, B6, B12, folate. You have to start looking at your circadian biology, like your light exposure throughout the day. Actually, it it controls your hormonal cascade throughout the day. So are you getting out in the sun during the day? Are you looking at your cell phone, your computer, or TV screen at nighttime? All of those things are going to affect the production of testosterone. And then what about the things that can inhibit it? Heavy metals like aluminum, cadmium, lead. If you get exposure to plastics, like if you're drinking a plastic water bottle all the time, or you're heating up your food in a plastic Tupperware container, those can leach out into your food and you can start getting increased estrogen because those plastics act like a synthetic estrogen, and that will help drop testosterone. So you have to just start, again, looking at all these areas that are contributing to low testosterone instead of going right to testosterone replacement. Yes, I think it can be useful to kind of help bridge people. But again, the goal is identifying those factors that are contributing to low testosterone in the first place.
Well, it would also be helpful. I mean, I'm looking at my own T levels and I'm thinking it would have been nice to have my T levels back when I was 21 to know what they were. So I can figure out, okay, so have I dropped precipitously in the last 30 plus years, or have I always been at this level?
Yes, exactly.
I don't have that information.
And that's what I would recommend is even within your 20s now starting to get looked at, because we are seeing low levels in 20, 30-year-olds. And my last practice I was at, we would see a lot of females with like horrible hormones. Their testosterone's in the tank. They have no libido. So it's a big issue, and it's becoming, it's happening earlier and earlier in people's lives. So it's really valuable to get it tested. But then once you test it, the goal is, okay, now let's figure out why this is an issue and address that instead of just going right to the prescription pad.
Well, one of the things that was fascinating to me, we were talking about T levels in women, and I guess, so correct me if I'm wrong, but an average or normal range for a man for a T level is somewhere between 250 and 1100, somewhere around there.
That's about right. Yeah. I try not to be too specific.
It's hard. Yeah. I think we're still trying to figure that out. And for women, it's like, I don't know, 20 to 50. But what he was saying was that a lot of times as the women reach perimenopause and menopause, the T level just goes into a dive. And that's where a lot of times women are like, I don't care if I ever have sex again.
Yes.
Like the sex drive just goes off the table.
Yes. So that's why it's valuable, again, to quantify where you're at so you can start putting together a game plan to figure it out.
The other thing that was fascinating is he was saying that, that he actually cured his own prostate cancer with this testosterone replacement therapy. And I think that's true to a point. I think when it gets in later stages or the PSA levels get too high, that it doesn't make a difference. But if at the earlier stages, it can have a big impact. And
I think that's really funny because if you talk to a lot of people, a lot of doctors, they'll say, no, one of the main prescriptions is for a medication that drops your testosterone to treat prostate cancer, right? So it's really interesting that he's using the opposite approach and getting results.
And I think there's some anti-intuitive research that's just come out recently, I think out of Harvard, that shows that one drives the other, not the traditional way it's been thought about.
Yes. Yep. 100%.
So, and I can't even speak to it that well, but, so what are your beliefs around conventional medicine versus more functional medicine?
Yeah. So I think no matter who we're talking about, everyone has their head in the right place. Everyone really generally seems to care and they want what's best for people. It just depends on what your goals are. When it comes to acute things like injuries, surgeries, broken bone, significant infections, conventional medicine does a fantastic job. They're very, very good at it. If I had a broken bone, I'd go to the hospital. When it comes to dealing with chronic disease, that's where conventional medicine just doesn't really work that well. If we look at the rates of chronic disease throughout the US currently, obesity's increased 50% in the past 30 years. Diabetes increased 10 times in the past 60 years. Depression, anxiety has gone through the roof, as you know. And that's despite the US spending over $1 trillion in healthcare a year. And that's significantly more than any other society. So we're not actually getting better health outcomes. People are living longer than they used to, but we're not living better. So that's where I think functional medicine comes in. And when it's practiced correctly, when you are addressing the root causes and you're not just in it to sell supplements, that's when you really get, that's how you address chronic health issues, by addressing the root of the issue.
So, you mentioned some of the factors that you look at, plastics, environmental, exercise, mindset. One of the things we talked about briefly before we got on the air was vaping.
Yes.
Speak to that a little bit, because that one it's a hot topic right now because we're seeing more and more of these lung illnesses in really young people. that shouldn't have these lung illnesses.
Yes, yeah, and this is one thing that actually one of my pharmacology professors in school taught me. She said, whenever something new comes out, whether it's a medication or product, you should always wait 10 years before you try it out, because you just don't know. Even if they've done pre-market testing, which they haven't done with vaping, but they do with pharmaceuticals, you still just don't know the long-term consequences. So you want to be cautious. So that's always what I say with things like this. If you do want to, it depends on the type of vaping we're talking about. Is it THC? Is it CBD? Is it nicotine? But any of those things that if you're trying to replace it, there are just better options than introducing it to your lungs. You can do sublingual through your mouth. That's absorbed pretty fast. You can do oral. So that's going to take a little bit longer to work, but it's going to be effective. I just think those routes are going to be a little bit safer. But I mean, the vaping thing is, it seems as we were talking about, one of the big issues is it's a lot of things that are on the street that aren't regulated. And this is where we're seeing a lot of issues. So if you are going to go that route, if you're hell bent on it, just go to a reputable place that does third-party testing. So they send it out to a lab that's independent of the company that will assess for any hidden toxins, heavy metals, any residual solvents. And just make sure you're being careful with that, because again, we just don't know the long-term outcomes.
So would vitamin E acetate be in that list?
Yeah, that's a good, you know what? That's a good point. I think you would have to look and see, but that, again, John's bringing this up because that was what they had recently said was the link between all these vaping illnesses. So I'm not actually quite sure if that's on it, but it certainly should be now.
Well, I've seen a lot of high school students in the past many years, and vaping just exploded. Yes. And nobody thought there was anything wrong with it or any harmful effects to it. And I would try and caution them, and to no avail.
It's so tough too, because we're talking about teens. I remember when I was a teen, I wasn't going to listen to an adult about what I was going to do. And I understand it's regulated the same way as tobacco is now. But at the same time, if we try and really tighten the restrictions and we start kind of saying, you know what, we're going to outlaw vaping or certain things, kids are going to find a way to do it. And really, again, the big issue here was it was the unregulated market that was really causing a lot of these issues. So we don't want to push people towards the getting things off the street. We want to educate them, make sure we're enforcing the age restrictions. Parents stay on top of their kids to make sure they're, as best they can. But yeah, it's a tricky topic.
It is. Yeah, it's a tough one. So yeah, thanks for covering that, because I understand you were just on TV talking about that. So wanted to throw that in there.
Yeah, you got it.
So what actionable steps can men take to evolve themselves physically?
Yes. So there's, again, I think a lot of recommendations have to be tailored to the person, but there are certain things that everybody can do. So, and those big things I think are really about your environment. So making sure, again, that you're getting outside during the day, you're getting out in the sun, not so much that you burn, obviously, but you actually do need some sun exposure throughout your skin and your eyes. It's actually very healthy for setting that circadian rhythm. It will help you sleep.
And you're saying get out in the sun without sunscreen, correct?
Yeah. Get as exposed as much skin as possible, no sunscreen. And then again, if you start getting any pink, cover up. So you just want to, it's nuance. You don't want to go completely avoid it, but you also don't want to get burnt. Make sure you're getting sleep at night, at least 7.5 to 8 hours. The number of people who can get away with less without seeing an effect is rounded to a whole number is 0%. So get your sleep. It's supremely important, especially for energy. Testosterone, again, sleep's a big thing for improving testosterone production. So again, stop carrying your cell phone in your pockets if you can. If you value your testicles, stop radiating them. And food-wise, generally just eat a varied and diverse diet of whole foods. That's kind of the goal, is get as much variety as you can. This is hard for men. Men a lot of times want to just do the same thing every day, rinse and repeat. All right, chicken, broccoli, and I'm going to do that for dinner, breakfast, lunch, and dinner every day. Get some variety, because when you cut out a lot of food groups, you create nutritional deficiencies by omission. So that would be a few things. And then again, move in it. Just get outside, move around, whether that's running, walking, dancing, just move more.
So move more with the intention of getting the blood flowing, building muscle, getting more flexible.
All of that. Yeah. So I'm not dogmatic about it should be weightlifting or it should be running. I think variety is really kind of the big thing when it comes to whether you call it exercise, but just taking on different positions is really going to keep you mobile. It's going to keep your body feeling good, as opposed to going in the gym and just doing these curls and squats. get some variety in the way you're moving as well.
Excellent. All right. Thanks for covering that. So you mentioned earlier that, we have an epidemic of obesity here in the US. So for those men out there that are interested in losing weight, what are your thoughts on some of the latest diet crazes like keto?
Yes. So, and I'm really glad you brought this up, because I realize what the question most men or most people are asking is like, how do I know I'm doing it right? Like, how do I know this is the diet for me? I'm looking online at different bloggers and podcasts and go, well, this person looks like they lost a lot of weight on keto or a paleo diet or intermittent fasting. And I think they all have their merit. They all have clinical value, but it all, again, depends on context. Some people do fantastically on a ketogenic diet and other people crash and burn. But just because you lose weight on a diet doesn't necessarily mean that it's healthy. I've had a colleague who lost 40 pounds in 2 weeks on the divorce diet, if you know what I mean. So, he was eating the same amount of food, but he lost 40 pounds in 2 weeks because of that. So the point is, like, just because you're losing weight doesn't necessarily mean it's healthy. So what I always like people to understand is, I think it's about quantifying what you specifically need, and then you can tailor the diet based off of that. So, like, I do this with my clients, and I was actually talking with Trip Lanier, who you've had on the podcast, and we've done some labs together, and he was like, dude, this is so valuable. How come you're not offering this to like middle-aged men? Because recently I've only done just 6-month programs, because that's a clientele I've been attracting. But he's like, some guys just don't want the handholding. They just want, give me the labs, give me the review of it. Tell me what I need. Tell me the supplements, what I need and don't need, and I'll do the rest. And so that's why I've started recently putting together a package for specifically middle-aged men to help them dial in specifically what it is they need nutritionally, supplement-wise, without this long-term commitment. Because again, I think it's really valuable, and there's just so much noise and confusion online about what diets you need, what supplements you should be on, and people are just kind of like throwing darts at a board and hoping something sticks.
Yeah, I think that sounds like a great service. I agree with Trip. Get that out there. And by the way, where can we reach you if we want to reach you on social media?
Yeah, social media, it's Jon Mitchell PA on Facebook, Instagram, and then my website, same thing, jonmitchellpa.com, and John's is just Jon.
Excellent. So the wrong spelling.
Yes, exactly. I always call left.
Throw that in there.
Wrong-handers, so I get
do you get a lot of people spelling your first name Jhon?
Jhon. No, I've never gotten that. I got John.
I get that all the time. I'm like,
do you?
Where did you ever see that?
You have a lot of dyslexic friends, I guess.
I guess so, yeah. Okay, but anyway, a little tangent there. Even if it's intermittent fasting, like I have a friend that's my age, 52, that him and his wife are doing intermittent fasting, and he's like, oh, it's great. Like I've lost, 20 pounds. I'm like, all right, good for you. What do you think about intermittent fasting?
Yep. So it's the same exact thing. I hate to be, I'm not dogmatic about it, but the approach, I think some people, they just do so well on intermittent fasting. And of course there are studies that show like intermittent fasting benefits people with type 2 diabetes and it can help with obesity. But again, the selection criteria for those studies is so narrow that most people don't meet the inclusionary and exclusionary criteria for that study. So for somebody to say, oh, well, there's this study that shows intermittent fasting helps with this. Okay, well, that helped with like some of those people within that group, but that's not everybody. And that's the goal, is for people to realize you are a category of one, you are going to respond to things differently. And, if you benefit from that, if you find you're doing well, that's fantastic. But there are also people I've seen who try it and they just crash and burn. So yeah, you just want to be careful.
So it seems to me you're kind of the opinion that personalized medicine is the way to go.
100%. That's essentially so Sir William Osler said it best. This was like a physician back in like the early 1900s. He said like the good doctor treats the disease, the great doctor treats the patient who has the disease. So that's really the goal. If you want to get really like amazing clinical outcomes, you have to treat the person and not a number, and not even just like a study, because not everyone is going to be in that study. You got people on all other, on different spectrums of the bell curve, and you have to meet people where they're at.
And this is kind of I guess the parting note here. I was watching Patch Adams recently, which is a movie I love. And, Patch was always trying to treat the patient.
Yes.
And not just the whole patient, emotions, physical, mental. And I remember at the end of the movie, one of the doctors comes to him and says, look, I'm the best doctor in here. I know the most. If I can do all the procedures, but I can't get Mrs. Wood in room 8B to eat. She's starving to death and I can't motivate her to eat. So where does that piece come into your practice, that piece of motivation of relating to other humans?
This is, I think, one of the big things that keeps clinicians from getting the results they want is you have to be there with your client or patient every step of the way, and you have to meet them where they're at, and you have to take them where you kind of, I don't want to say push, you have to kind of pull them along with where you want to go. It's hard because a lot of times people don't want to change and they have a lot of mindset blocks, and you have to be able to motivate them in the right way. And that means some people it's being a little bit harsher. For some people, it's being a little bit softer. So it takes a lot of different soft skills. And I think that's the hard part, because a lot of doctors, they don't want to tell people what to do. They're like, well, like take it or leave it. Sometimes you have to bust your patient's chops and say, like, listen, what you're doing right now is getting you where you are, and we have to change it up. If I have someone who comes in smoking cigarettes, I'm like, listen, we have to work on getting over this, and I will work with you through this, but it's got to be done. I'm not going to take you on if we're not going to address this.
Right. Yeah. It makes me think of the fixed versus growth mindset. And, there's a belief now that growth mindset is really the mindset that underlies all other mindsets related to success and happiness and health. Because, I've seen it in my own clients where they come in and, I'll talk to them about their willingness to change or their belief that they can change. And if they've got a fixed mindset about that, like, kind of love me or leave me, or I'm not going to change, or I don't believe change is possible, like that stops things right there. So if you don't address that belief first, everything that comes beyond it doesn't matter.
It's huge. So yeah, it's always about like finding that leverage point and going like, all right, well, this person was able to achieve, we did this, and just finding what's important to them and start presenting it in ways that it's like, yes, this is what I want to go towards, and it is possible, but it does take time. And this is why I think it's so important to work with someone who's willing to put in that time, because a 15-minute visit with your doctor, you're not going to be able to get anything done with that, because change a lot of times is confusing and it's not linear.
Good point. Yeah. And I'll say that when I'm working with people's emotions that, or even sobriety, it's a jagged mountainscape, right?
Yes.
You go up a little bit, you make improvement, you fall back down. You go up a little bit more, you fall back down. There's improvement, regression.
Yep. This is why I'll never like berate a client, or I'll never say, make them feel bad about what, if say they were trying to quit drinking and they went back on. I'll just say, okay, well, let's just look at the situation about how did you fall back? Like, what was going on? Tell me about the conditions. Where were you? What were you doing? Were you hungry? Were you in a certain situation that triggered a certain feeling? And we'll start to unpack it and then start to figure out, okay, these are the ways that we're going to address this if you get presented in the same situation in the future. So we're going to be solution focused instead of just saying like, you messed up,
Yeah, I really like that approach of coming at them with curiosity and compassion.
That's the only way people are going to change is I think curiosity is probably one of the most underrated but most important things in life in general. I
agree.
The way to relate to people, the way to learn is just by being curious. And I've learned so much from my patients just by being curious and asking them questions. Like they've been my greatest teachers.
And even just by saying something like, gee, I'm really curious about blah, 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 blah. Tell me about this, or how did you get to that?
Yes.
It's non-threatening generally.
Yeah. And a lot of times, like, we don't know what somebody's going through. So like, this is a Stephen Covey thing from the 7 Habits of Highly, I forget what 7 Habits, but he says, seek first to understand and then to be understood. And it's totally true. You have to first try and understand people, because if you just start speaking to them and telling what to do, it's not going to resonate.
Fantastic. Well, great words of wisdom, Jon. Thank you very much. Is there anything that I didn't ask you that I should have, or anything that you would like to add?
No, that was perfect. No, it was a lot of fun. Second time around, I think we nailed it.
And thank you again. I really appreciate it. And that's it for this episode of The Evolved Caveman. Again, Jon Mitchell. You can check him out at Jon Mitchell PA on Facebook, Instagram, website.
JonMitchellPA.com.
And those links will be up in the show notes, so you can check them out there as well. Thanks so much, everybody. Bye-bye.
thank you for listening to the Evolved Caveman podcast. If you like what you've heard, support us by subscribing, leaving reviews, and sharing the podcast with friends and colleagues. For the latest, most powerful tools to connect with like-minded men, join the Facebook group at The Evolved Caveman. Follow Dr. John on Instagram at The Evolved Caveman, all one word, or join the email list by visiting guidetoself.com.